Good morning, everybody. How are you? I hope you guys are doing really well. So I just wanted to pop in and have a chat to you about some of the stuff we've been learning recently. As you know, we've been discussing Parkinson's in April, and we want to continue this month as well. A little bit more. So we've actually been looking at the autonomic nervous system a bit in relation to concussion and Parkinson's and all sorts of things that are going on at the moment. So I'm going to discuss the autonomic nervous system in relationship to Parkinson's disease today. So for those of you who haven't met me yet, my name's Sarah Hopkins. I'm owner and one of the senior physiotherapists here at Hibiscus Neuro Rehab. And we just love bringing you content and things which you can learn a little bit more about your nervous system and help you live your best life. So I've got some notes here this morning because I really want to make sure I just get all the points that I wanted to talk about because this is a really massive topic. So Parkinson's disease and the autonomic nervous system. So we know that Parkinson's disease is a degenerative neurological disorder, which we talk about being based in the basal ganglia. And it's classified by motor symptoms such as bradykinesia, which is slowness of movement, rigidity, tremor, and also non-motor symptoms. And these include cognitive changes, neuropsychiatric changes, sleep, and autonomic issues. It's thought that with Parkinson's, they've shown that the pathophys has been found that there's degeneration along the chain of neurons forming the autonomic nervous system. And this is thought to occur early on in Parkinson's. So with the autonomic dysfunction, when people are looking at it, the research is really looking into whether this can be an early diagnosis for people with Parkinson's. So they're looking at that. Now, in this video, we're just going to take this deep dive into the autonomic dysfunction that occurs with Parkinson's. But just briefly, the autonomic nervous system is made up of the sympathetic and parasympathetic nervous systems. And this is the flight and fight and rest and digest systems. It works without conscious control on things like digestion, heart rate, sweating, bowel and bladder function, and also affects mood and emotions, among other things. So it's really something that's not within our conscious control, and that's why it becomes a non-motor symptom. Autonomic dysfunction that can occur with Parkinson's include things like bowel and bladder dysfunction, changes in cardiovascular status and blood pressure, gastrointestinal issues, sexual dysfunction, skin issues, and it also has an impact on the motor symptoms such as tremor, freezing, and some of those cognitive symptoms such as anxiety. So I'm quickly going to touch on the motor symptoms before we dive in a little bit more into those non-motor symptoms, what is happening and what can we do about it. So it's been shown or thought in the research, and this is an emerging field, that there is a link to tremor and the autonomic nervous system. And we know that when we're treating clients, that if they do some breath work and really try and focus, they can actually lower their tremor. And we know that breath work really links into that rest and digest system, the parasympathetic nervous system, by using breath to stimulate the vagus nerve and get that system into a more rested state, which can lower that threshold and the tremor kind of settles. Again, when we put our system under stress, which is firing off the sympathetic nervous system through exercise, we will often see tremor increase. So using exercise and breath work, we can actually help modify a patient's tremor with Parkinson's in terms of turning it up and down. Freezing of movement has been shown now to be also linked to the autonomic nervous system. What's been shown is that there can be an increase in heart rate prior to freezing of gait, And this is thought because there is a link into the limbic system, which is our system that controls memory and emotion and helps with mood. We also see that there can be anxiety states within Parkinson's, which is again linked into that limbic system. Another tick for the autonomic nervous system being involved in Parkinson's. So it's been shown that about 90% of people with Parkinson's disease will experience some form of autonomic dysfunction or symptoms. And unfortunately, the medication that we take, the levodopa therapy that is taken, can increase the side effects and make some of these symptoms worse. So what are some of the non-motor symptoms that are linked into this autonomic nervous system? So we said problems with the stomach or the gastrointestinal system. It can cause slow emptying of the stomach, which can cause symptoms such as bloating, nausea, vomiting, heartburn, an early feeling of being full, weight loss, and also pain. So this can be improved through regular exercise, nausea management such as things like ginger, monitoring weight, talking to the doctor about medication for nausea management, and heartburn as well. Other gastrointestinal issues that can occur are things like constipation, which is quite common. So that is classed as fewer than 3 bowel movements per week. And this is due to a couple of things. It can be due to a slow transit of waste matter through the bowel itself because of the lack of innervation of that smooth muscle. And it can also be affected by pelvic floor dysfunction because there can be a difficulty in relaxing those pelvic floor muscles and the sphincters due to the rigidity. And often medication can also make constipation worse. So you can help this by having an increase in fluid, making it warm in the mornings, making sure you've got good dietary fiber that you're taking in, and also thinking about with dietary fiber, making sure that you can take that, and with fluid that there's no contraindications to that. By that I mean that you're not on any fluid restrictions or that you haven't got any other stomach issues that you need to monitor dietary fiber. Again, regular physical activity can be really good, gets everything moving really well. Using things like kiwi fruit or prune juice can help, yoga and probiotics. And discussing medication with your GP, such as stool softeners, can actually also be helpful. So another autonomic dysfunction that is very regular in people with Parkinson's is orthostatic hypertension or low blood pressure, especially when standing up. And this is thought to occur because of poor baroreceptor response in Parkinson's, which is the receptors that sit in the aortic arch and help modulate your blood pressure. So this is thought to happen in up to about 60% of people with Parkinson's, but for some people it actually may be asymptomatic, which is you might not know that you're having a drop in blood pressure. So it's worth making sure that you're getting your blood pressure monitored regularly to see what's going on. And symptoms that may occur are things like dizziness, blurred vision, headache, fatigue, and again it is impacted on by levodopa therapy, so this can also make it worse. So if you're finding you're having some of these symptoms, it's worth getting it checked out. Just remembering that dizziness can also be a vestibular concern as well. But you want to talk about blood pressure with your GP and look at what medications can either increase your blood pressure, or if you're taking things because you've had high blood pressure in the past, that you may need to change these medications. You want to think if you're having drop in blood pressure, it may be that you need to do some lifestyle modification type things, like when you sit up, making over the edge of the bed, you might just need to sit there for a moment before you stand up, so you give your body time to regulate that blood pressure. Exercises before you stand up can be really good, things like pumping your ankles to help return of the blood further up your body, leg movements before you're standing up. And regular exercise again is important because it helps regulate your system, helps make blood pressure regulation. It's important with drops in low blood pressure like this that you are managing constipation, because that can impact on your blood pressure as well. Making sure that you're getting adequate fluid intake and salt, as long as these are not contraindicated for you. And if it is severe, you can look at things like pressure garments. So that can be things like skins that you can buy off the shelf, or compression stockings, or abdominal binders, which you can talk to your therapist or your doctor about as well. Other issues that can occur are bladder dysfunction. So there can be an increase in urinary frequency called nocturia over night time, and that can be because we're not getting that bladder emptied properly during the day. You can also have irritative or obstructive bladder disorders, and that's when you have irritative bladder, that can be because you've got a hyperreflexive muscle of the bladder, or if it's obstructive, you have a hyporeflexive bladder muscle, which means you're not getting, either one's really tight, so you're not getting empty, or one's really loose, so it's not working properly either. So to manage this, it's things about scheduling when you're using the bathroom, and especially going before you leave the house, using things like easy to pull down clothing, continence products such as pads and breaths, uridomes and catheter tips for men at night time. Reducing bedtime fluids can help with bladder function overnight, but remembering being dehydrated can also irritate the bladder and cause you to want to go to the toilet more often. So it's about getting that balance of fluid correct. Constipation, managing this if you're dehydrated will be worse, so this will also irritate the bladder as well. And doing things like pelvic floor exercises is really important. So you can either talk to your physiotherapist, or there are dedicated women's health and pelvic floor physiotherapists that can help with this specifically if it is a real concern. So other things that can be a problem are sexual dysfunction, and is again linked to poor autonomic nervous system function, and this can happen for about 81% of men and up to 43% of women, and this can be discussed with your medical team, but knowing that this is an issue and it's something that can be discussed. We can also have changes with our skin, so there can be some autonomic skin changes, and there can be excessive sweating called hyperhidrosis. And this is thought to occur due to a reaction in the lower sympathetic nervous system function to the extremities, and also decreased innervation to blood vessels and sweat glands, as well as changes to function in the brain stem. So with hyperhidrosis, is excess sweating. And you might find this in your hands or when you're exercising, and that's just because of that autonomic nervous system dysfunction. Again, you need to watch hydration levels if you are having excess sweating, because you can excrete more fluid and then play with your salt levels and also be more dehydrated, which can again impact on the constipation and bladder function, as well as making you feel dizzy and your brain not functioning, because we know the brain is made of 70% water. And so also, having an extra towel with you can help manage this as well, but it's important to keep exercising with that. You can get hypo hydrosis for some people as well, which is a decrease in sweating, and so that will impact on temperature regulation. With temperature regulation also being affected and being controlled by the autonomic nervous system, so there can be a change in people feeling colder or hotter with that as well. So just looking if you're feeling cold or that you get warm, thinking about wearing layers to help manage that as well. And there are other things, just to mention, the autonomic nervous system also affects pupils, and the lacrimal glands around the eyes and the salivary glands. So you can get changes with those as well. So these are all things to think about and be aware of, that it's part of the autonomic nervous system, which can be a dysfunction within Parkinson's because of some changes within that system itself, within the nerves and within the brainstem, and with those links to the central autonomic system as well. So those are a really quick overview of what is a quite complex and detailed issue that can occur. But just remember, you're not alone and these things are happening. If you're finding you're having any problems with them, please seek help from your medical team. Either speak to your GP or your therapist. Or if you've got any questions, please feel free to pop them in the comments below or send me an email. Sarah at Hibiscus Neuro Rehab. We love to help. Hopefully you've found this video helpful. If you have, feel free to give us a message or share it to anyone that you think might benefit from listening to it. Okay, so I'll speak with you later, and next week we're going to talk more about the autonomic nervous system, and we're going to also be talking in a few weeks on the autonomic nervous system in concussion. Okay, speak with you later. Bye.